Hello, welcome to Philosophy Roulette 121. This is 121, where we get philosophy papers off the internet and read them. Today was I was like, oh my god, I'm running late. I didn't even realize it doing other stuff. But now I'm here, only a minute or two late, or a few minutes late, and let's go get some philosophy, so we'll find out. Let's see what new is, if there is anything new since this morning. No, this is where we were this morning. No idea what that is. Survey of logic. Journal of the American Medical Association. Well, that's not, the ethics of COVID-19. More logic and more medicine. Interesting. Sexual consent and having sex together. Let's see what all this stuff is, if there are any of them. Oppressive things. See how long all of these ones are. 1 to 31. That is scary long. That would be a few hours, an hour and a half. This one is, I don't know. See if we can find it real fast. Free. Let's see. Oh, hey. No, I don't want advertisements. Let's see what download PDF looks like. Oh, I have to sign in. Ugh. Well, that's interesting. I don't think I've read anything from the American Medical Association, but it's an ethics paper, so that's cool. So maybe sexual consent and having sex together. Oxford Journal of Legal Studies. Well, I don't think I can get a hold of this. At least not right now. Alright, so what's this? Oh, this is the same thing. Banatar and the badness of all human lives. We're all very bad. Critique of Banatar something or other. 1 to 13, so that's a not very long paper. I like that. Let's see if we can find it. Well, it's too bad. If I can't get it, I can't get it. Oppressive things. Shinley Yao and Bryce Harper. Download now. See how bad. What's the damage on this? 26 with single spaced. Okay. Not doing that. So, the ethics of COVID-19. Alright, I just wish I had knew how long this was before I just jumped in. It doesn't really look terrible. Keep going. Okay, we'll read it. So, just because it's very timely. Immunity passports are cool. Hot topic nowadays. Also, if you are super fast and in the chat room talking to me and you want to get a piece of paper, you can type in !paper into the chat box, because this link probably won't be there when you show up. So that will bring you back to this page, and you can just click on link down here just the same. I really wish I had a fish and I didn't have to read stuff on here, because I can't download it. Right, let me see if I can. Free personal account. If I have to do email stuff, I'm just not doing it. Yeah, not happening. It's not that I can't. It's just that this is I actually have very little on this computer. It's a single. This is a project box for me. It's just I just do like 1 or 2 things on it, and so I don't have any of my. I don't want to pull my login. So if this box breaks or anything, I don't lose anything. But on the upside, I don't have anything important here either, so I don't bother with it. All right, so we're gonna have to suffer through advertisements. I'm sorry, I did not. First time with advertisements. that said, the ethics of COVID-19 immunity-based licenses, immunity passports. Chile, Germany, and the UK, among others, have indicated they will implement certifications that a person has contracted and recovered from coronavirus disease 2019, COVID-19, or in the future has received a COVID-19 vaccine. Such policies have been discussed but not implemented in the United States. However, if other countries require these certifications for entrance, the US may adopt them to enable travel, generating calls to use them more broadly. Certifications of immunity are sometimes called immunity passports, but are better conceptualized as immunity-based licenses. Such policies raise important questions about fairness, stigma, and counterproductive incentives, but could also further individual freedom and improve public health. Immunity licenses should not be evaluated against a baseline of normalcy, that is, uninfected free movement. Rather, they should be compared to the alternatives of enforcing strict public health restrictions for many months, or permitting activities that could spread infection, both of which exacerbate inequalities and impose serious burdens. This viewpoint presents a framework for analyzing the ethics of immunity licenses. Yeah, I think this is the most topical thing I've ever read. Yeah, sorry, things getting twisted and it's annoying me. So, although some of the other ones were a little topical, this is like really topical. Liberty, immunity-based licenses, and the least restrictive alternative. The ethical values of liberty and autonomy support a presumption that policies should consider immunity to COVID-19. Look in the supplement. This may seem counterintuitive because people who are not immune may have their liberty limited if they hold certain jobs or travel to certain places that require a license. However, public health is committed to protecting liberty and autonomy through the principle of the least restrictive alternative, which proscribes measures more restrictive than necessary to achieve public health objectives. In other words, people must be allowed to pursue their life plans unless doing so is incompatible with public health. Yeah, well, what is public health? I mean, and who gets to define that? It becomes a major deal at that point. I mean, it's if you're in the U.S., you're seeing a lot of news stories about like jogging while black at the moment. That doesn't seem like it seems like it's a very public thing, but you're not very healthy if you're jogging while black. So it's like whose public is the public here? The least restrictive alternative principle supports using COVID-19 immunity licenses if available. Current liberty limiting restrictions on gatherings, work, and travel are justified because infected people may be harmed or die and may harm others by spreading disease or overburdening hospitals. But they are not justified when applied to people at little or no risk of infection. The people of the least restrictive alternative supports giving people a chance to show that they are immune. Yeah. This is who gets giving people a chance. Who gets this chance? Because there's not like there's some sort of easy way to give everyone the same chance. That never works. Okay. How might individuals be given the opportunity to demonstrate immunity? Yes. Drivers and pilots' licenses and similar policies suggest a way forward. Rather than banning risky activities, licensing permits people to participate in these activities, but only after evidence of safety, such as through competency tests, has been demonstrated. The same could be true for immunity and risky activities during the COVID-19 pandemic. So you have to prove you're not an idiot even if you already had it? Maybe. The term immunity-based licenses is better than immunity passports. Passports suggest an all-or-nothing permission and endorse categorical denial of access to an entire country. In contrast, licensing requirements are more stringent for drivers of school buses or airplane pilots than for drivers of cars, and are more restrictive for younger drivers or those with conditions that may impair driving. More importantly, these restrictions are ethical and legal even when a person's higher risk or inability to pass a test is outside their control, as with drivers who are visually impaired or have epilepsy. By analogy, in the setting of COVID-19, immunity-based licenses could apply to specific high-risk activities such as working in a nursing home and could permit exceptions and gradations. Alright. I mean, the worry, of course, is that you're setting up a stratified society where the people who have the license are going to have all the freedom, and then you're gonna have a black market for licenses and all that sorts of stuff, and only the rich people get licenses. And I mean, the gradations sound kind of good in terms of like like car driver, bus driver, truck driver, all those things. It shows specific skills and safety regulations understood, but I don't know about this because the understanding of COVID-19 at the moment is so low that the gradations just seem to be terribly underspecified. Okay. The ethical case for immunity-based licenses can be buttressed by working to ensure that licenses do not exacerbate inequality. Yeah, well, how in the whole world are we never gonna pull that one off? Like I said, jogging while black seems like a public health thing at the moment. Driver's license fees unfairly burden lower income individuals, and transportation for those unable to drive is often inadequate. In contrast, ethically sound immunity licensing policies would reject license fees and would ensure that unlicensed people are not subject to social or economic exclusion. Banned from entering grocery stores, using public services, or traveling, or confined to their homes for an indefinite period of time. Yeah, how do you do that? That seems, I mean, it sounds good, but I have no idea how you can actually ensure that someone without the right licenses are not shunned. Activities currently permitted under public health orders, like walking outdoors, driving, interacting with household members, and shopping or working remotely or at businesses like grocery stores, should not require immunity licenses. The list of activities that require licenses should change in response to public health needs, as the least restrictive alternative principle requires. So what would actually that be? Like, if you're a bus driver and you have a chance to like deal with tens of thousands of people a day, maybe that has the most stringent requirements. It's like, I hope the bus drivers are getting a raise. Immunity-based licenses and ethical values. The ethics of COVID-19 immunity licenses can be assessed with respect to three fundamental ethical values: the maximization of benefit, priority to the least advantaged, and treating people equally. These values can... How do you treat people equally and then give priority to the least advantaged? I don't understand that already. These values can be consistent with a well-designed implementation of immunity licenses. First, immunity licenses could maximize benefits by safely enabling patronage of bars and restaurants and in-person attendance of cultural, worship, and sporting events. Permitting these activities without risking infection would increase tax revenues, which could be earmarked to fund COVID-19 response and reduce social harms caused by unemployment and isolation. This is also, like, I mean, idealistic, but that's just not where the money goes. Yeah, I have no idea how we're paying for anything anymore. If, like, under the mentality of paying for things, which is usually the wrong way of analyzing stuff in our society, because it already sets you up to be in a certain mentality, just sort of like, where's the money coming from? I mean, we just printed $2 trillion or something, so I'm not exactly sure about the economic arguments here. But yes, tax revenues going up is good for the government. Second, immunity licenses can be consistent with priority to the least advantaged, that is, people who are medically, socially, or economically vulnerable. Under strict public health restrictions, no one would be able to perform in-person social and economic activities. Conversely, if some activities are made conditional on licensure, only people who lack immunity licenses may be disadvantaged in comparison to others. Generally, society avoids policies that level down. Bringing every person down to the least advantaged position does not solve the problem of disadvantage. Meanwhile, although workers with immunity license might receive offers so lucrative they would be difficult to refuse, generous offers are not coercive. Further, all workers, including the immune, would retain legal protections against being coerced to work. Are you in the United States? Like, I sure hope... I mean, this is the American Medical Association. It's like, that's... Yeah. I mean, they just released, there was just some news stuff today about how, it was a headline in the Times saying, look, what were originally, or just a few months ago, were illegal workers in some of these plants or in some fields and farms that were considered like illegal labor are now being declared necessary and like that you can't stop work there because they're so important. They're essential workers now, when like 3 months ago they were illegal workers. So it's and these are people who can't afford to not work. So it's like, what do you mean legal protections against being coerced to work, when from the government side this is getting shenanigans are getting pulled at the moment. Not that shenanigans aren't always getting pulled, but it's just, these are nice principles, but I don't know, it seems like implementation here is going to be critical. Okay, more importantly, just as the work of licensed truckers benefits those unable to drive, the increased safety and economic activity enabled by immunity licenses would benefit the unlicensed. For instance, preferentially hiring immune individuals in nursing homes or as home health workers could reduce the spread of the virus in those facilities and better protect the people most vulnerable to COVID-19. Friends, relatives, and clergy who are immune could visit patients in hospitals and nursing homes. A third consideration, indeed a major concern, is that immunity licensing might seem to stigmatize people, undermining the value of equal treatment. Are immunity-based licenses like the Yellow Star's Nazi forcing Jews to wear, going all the way right there? Okay. Well, they split communities in two and stigmatize those without immunity. The Yellow Star and similar forms of invidious discrimination divided people based on race, religion, and heritage, all factors that should be irrelevant to social participation. In contrast, vulnerability to COVID-19 is a factor that public health policy already legitimately considers. Any inequalities produced by immunity licenses would not be invidious and would serve the interest of public health and of the disadvantaged. Importantly, refusing to create a regulated license program will not avoid stigma and inequality. In the absence of licensing, businesses and individuals may instead elect to use unregulated evidence of immunity, such as test results, or to use assumptions about the immunity or vulnerability that are likely to be arbitrary and biased. I mean, this is just like black market. You're going to get black market licensing one way or the other. So what's the least bad solution here? I don't know. I have no idea. Okay, here's where the rubber hits the road. Practical challenges in implementation. COVID-19 immunity licenses can be ethical in principle, but in practice depend on 4 important questions related to both the actual evidence and effective implementation. First, serology tests used to determine whether someone has COVID-19 for licensing purposes must be valid and reliable with high specificity and sensitivity. This requires a government body such as the FDA to establish and impose valid evidence-based certification procedures. Yeah, like that's going to happen in this like really fast. That'll take a while. Immunity-based licenses can only be introduced if serology testing is accurate. I mean, we can barely test for the COVID-19 right now, so the immunity test, I'm sure they're working on it, so hopefully it'll be done soon, but still, just the crap show is not very encouraging at the government level. In addition, depending on rigorous evidence regarding the duration of immunity, periodic testing and renewal of immunity license as designated intervals based on specific criteria may be necessary, similar to the renewal process for driver's license. Second, immunity-based licensing requires evidence that a positive serology test result indicates immunity. Otherwise, licenses could cause more harm than good by creating a false sense of immunity and facilitating spread. As research into immunity progresses, a guiding principle will be that no certification or test is perfect. Some licensed drivers drive dangerously and some unlicensed ones drive safely, but licensing improves overall safety. A similar trend would likely exist for immunity licenses. Well, that's fair. Third, in the absence of a vaccine, the benefits of licenses might encourage uninfected people to relax protective measures or actively seek infection. Yeah. This is analogous to parents organized parties to intentionally infect their children with varicella, despite the potential for very small risk of brain damage or death from infection. Although this incentive exists to some extent, even without licensing, it is a concern that must be weighed against the benefits of licensing. It is difficult to completely prevent, particularly in a society that values individual autonomy. One strategy for mitigating this incentive could be to offer licenses first or only to people likely to encounter infection in any event, such as healthcare workers. Another approach could be to first license members of a low-risk groups, such as university students who are not being asked to take in as many personal protective measures. Yet another approach could be to focus licensing on high-risk groups who are less likely to voluntarily seek infection. A final option might be to have licensed applicants self-test that they did not intentionally become infected. These mitigation strategies could be phased in or out depending on whether there is actual evidence that this incentive is producing undesirable outcomes. Fourth, the benefit of immunity licenses could encourage forgery, illegal markets, or fraud by unethical physicians or testing facilities. These problems underscore the need for careful implementation through strategies like anti-counterfeiting designs, cryptographic or biometric features, and reliable chains of verification for tests. But they do not vitiate the advantages of licensing. The possibility of bribed examiners or forged documents has not undermined driver's licenses and passports. Yeah, but there's a difference there too, because these are issued by government agencies, and your local doctor is more bribable than the Department of Motor Vehicles. I had to get a new doctor, what was it, 3 years ago, and I was searching around town. I asked my neighbor if he thought of like some of the doctors. I was mentioning one of his names, and he said, "Oh yeah, that guy. Don't go to him. He's terrible." He said he's basically he's called the weed doctor because it's not legal here, but you can get it for medical purposes. He says the guys, all of his clients are just basically going to him to get a fabricated a license to smoke weed. Now, I have nothing against that, but it's just like that's like basically how he's getting paid nowadays. He doesn't care about the doctoring; he just cares about giving out licenses to make money. So it's like, just because there's a lot more doctors, you're going to get a lot more opportunity for forgeries because it's not centralized. So there's an interesting how this is actually implemented makes a big difference. Not that there's a problem with licensing and passports, but who the examiners are. The possibility of bribery to examine forged documents does not undermine driver's license and passports. Yeah, but those are really centralized things. Like, I got my passport renewed. You have to mail away to the U.S. government for that. If I had to get a license from my local doctor, I mean, I could go see him sometime this week, and well, my current guy, he's a hard ass, so he wouldn't do it, but the other guy might. Okay. So these are interesting thoughts, but it's just like, it's such a crap show at the moment, and this is nice paper. It should finish up. But I mean, you need an outline, you need a rubric to get going, and that's what this is doing. Conclusions. Immunity-based licenses have the potential to help realize important values, including enhancing the liberty of individuals who have been infected with COVID-19 without worsening the situation of those who have not been infected, maximizing benefits to individuals and society by allowing immune people to engage in economic activity, and protecting the least advantaged by allowing safer care for vulnerable populations. Importantly, immunity-based licenses do not violate equal treatment because the factors used to grant a license are not discriminatory, like race or religion, but instead grounded in relevant evidence. While immunity-based licenses require careful implementation and scientific support to be ethical in practice, nothing makes them unethical in principle. Yeah. Nothing makes them unethical in principle. It's just I mean, I happen to be a little cynical. I'm just a little, the way things have been going recently doesn't seem like, I trust the people to give out licenses in a sort of fair way at this point. I mean, as a guy in New York that looks like me, I never have any trouble with anything basically, but lots of people have trouble. Anyway. Okay, so this is like I said, this is a nice article in terms of setting out some initial structure for how to ethically think about an all of a sudden thrust upon us new policy that we need to have, which, we just need to have. Now, the few things got mentioned, of course, who's doing the licensing, and then who is judging, like, I expect the Journal of American Medical Association, they are going to trust their doctors as everyone does. They trust their own people to set up the guidelines for what actually counts as good testing and things like that. So that really is one of the things that I don't think it was mentioned here, but exactly what goes into they just say, well, it has to be high accuracy, like no false positives, no false negatives really, and then like a limited number of false positives just to do that stuff. But that whole system there is real. I'm not exactly sure how close we are to even that. We have a good test, I think, for some of this stuff, but I don't know because of how roughshod like everything is at the moment. It just seems that I don't even have confidence that the tests work the same across all populations, which we'd have to know to make sure that we can even do the testing in a fair way. I mean, there's a long history that is only now being corrected of minority populations not being part of medical studies, and so the treatments that are given only really they don't work for them, or they don't work as well, and so the remedies don't work for minority populations, or they don't work on women where they work better on men, or vice versa. So, that said, fine paper. It was nicely written. I'm thinking it from at the Journal of the American Medical Association. This is written for doctors, and in that sense, there's nothing really wrong with it. It's given the understanding of like some of the stuff I said, I'm sure all the people have this all in the background. So, nice paper. That's it for now, I guess, unless viewers have any questions, and I'll sign off till Tuesday. Okay. No one has anything to say? Alright, stay safe, everyone. I hope you all get your license soon. And I hope that you can even get it in the mail soon. The mail system's going to go down. Alright. But that's it. Bye-bye. Have a good night. Stay safe.